Now, in the last 3 months, we've seen Singapore gradually reopening its borders, but that increases the risk of infections creeping into the community.
That's right. So let's recap the different travel arrangements Singapore has with other countries. On our end, general travel to Brunei and New Zealand has been allowed from this month, but people here cannot travel to either country until restrictions are lifted over there. Singapore is allowing visitors from these two countries as well. They don't have to self-isolate for 14 days upon arrival if they had remained in the two countries for 14 straight days prior to their visit to Singapore.
We also have bilateral green lane arrangements with 5 countries: Japan, China, South Korea, Malaysia and Brunei.
And Singapore is in discussions with places including Indonesia, Thailand, Hong Kong and Australia.
Let's now bring in Professors Teo Yik Ying and Dale Fisher. Now, Prof. Teo is the Dean of the Saw Swee Hock School of Public Health at the National University of Singapore.
And Professor Fisher is a senior infectious diseases expert at National University Hospital. So while Singapore's imported and community cases have remained low, we're seeing a resurgence in many other countries, currently in Europe in particular. So given this contrast, should we further relax our restrictions on outbound and inbound travel? Professor Teo, why don't you start us off?
Well, thanks again for having me. I think it's important to highlight that there is no uniform policy on travel, and we have to consider the different tiers of restriction based on which countries we're talking about. Generally, I can think about performing a risk assessment on the basis of 2 aspects. The first is really the degree of community spread in a country. That should be preferably low, provided, of course, local authorities are able to get a good sense on the present extent of community spread in the country and not be underreporting or outrightly missing any segments in the population. And of course, second is having the necessary public health measures to track, trace, test, isolate cases quickly. And I think based on this criteria, some countries will clearly fall into the category of not allowing any inbound travel. Whereas we would see some other countries falling into categories that may allow some degree of restricted travel, perhaps for essential business travel, and others actually will be classified as mass market tourism even. And at the end of the day, it's about the chance that the rules we have in place for a country, whether they are able to stop an infected person from slipping through. And for a country where the situation is well under control, we really can afford to be a bit more relaxed and have actually the chance of missing someone coming in to be infected to be very low chance. Whereas for a country where the outbreak is widespread, we want to minimize incoming traffic as widely as possible.
Right. Well, Professor Fisher, where do you stand on this issue? Do you think it's time that we relax our restrictions?
Yeah, as YY just mentioned, it's all countries are different, and your question spoke about Europe, and that's not really the benchmark we should be talking about. I think there was a nice article today from Clara on a sort of a traffic light system of red and orange and green, and there's plenty of potentially green countries around. There's some with no recent transmissions. Places like Thailand, Cambodia, Laos, even China, Taiwan. These are all, they haven't reported cases for many months in most cases. Then there's others with quite good control. They know where their cases are. These are South Korea, Japan, Hong Kong, Malaysia. They've all had recent surges, but they've been able to bring their case numbers down just with some nuanced restrictions. The point is they've known where their cases are, and they've been able to contact trace effectively, do some selective changes, such as in nightclubs and coffee shops, and they've been able to bring their numbers down quite sharply. This is not what you see in many other places in the world, such as Philippines is still having problems, the Indian subcontinent, Indonesia, and as we mentioned, Europe and the US. So I think we need to look at different countries differently.
Right. Now, according to coronavirus analyst Thomas Puyo, fences are necessary to control the virus, and if they are enforced, they'll be effective. How does Singapore's fencing measures stack up against the standards that Mr. Puyo mentioned? Prof. Fisher, what do you think?
Singapore is in my view, leading the way in the sort of nuancing of these border restrictions. I think it's wrong to just bring in blunt, everybody must have 14 days quarantine like that. There are significant social and economic costs. This is not a zero-sum game. Let's just make sure and not let anyone in. This is, I think, too simplistic. Border closures, and just like lockdowns, really, they're a moment when you've bought some time, you can get your systems in place. And as we've seen in most of the Asian countries, many that I've just mentioned, most of them have got control of their outbreaks. They know where their cases are. So I would like to see border controls not be used so bluntly, and have, as I mentioned, a sort of a green, orange and red system.
Right. Prof. Teo, what do you think about that? Are there any weak links in terms of, our fences?
Well, at the moment, actually, I think, as what Dale has mentioned, Singapore has taken a very nuanced approach towards addressing importation risk. And of course, we have learned this the hard way, because back in March, we allow some of our returning travelers to spend the 14 days quarantine effectively, but at home. And that was what has resulted in some degree of community spread, which I would say that we are still trying to recover from it. So we are taking a cautious approach. And I think when we talk about the fences, it's very important to also talk about whether the country has that commitment to implement and to enforce some of these fences in a very sensible way. If we are requiring people to spend a 14 days period of quarantine, but they get to spend it at home, even if they're returning from some of the worst hit countries, we have to decide whether that is actually prudent. And of course, when Thomas talked about the fences, I think there is also a need to understand the context of some country setting, whether it is possible to have the same degree of fencing in every country, because there will be different ability to execute some of the fences that we talk about. Just even talking about quarantining people in the government dedicated facility. Singapore has managed to do that, but I don't think many other countries will have the ability to do so when they are faced with large number of people coming into the country all the time.
Right. Speaking of large numbers of people coming into the country, if our fences are gradually removed, does Singapore have the manpower and the resources to monitor incoming travelers? An example I'm thinking of is when, MICE events with more attendees will be allowed in Singapore soon. So, Prof. Fisher, what are your thoughts on this?
I must say that I'm not sure the term fence is the right way, unless you want to say there's a gate in the middle of the fence, because this is really about being selective. The risk is very, very low of even one person coming in. If you let thousands come in from New Zealand, even Thailand, Malaysia, China, the risk of even one or two people being positive is extremely low because of the situation in those countries. Now, of course, Singapore can deal with that. We have cases every day, and we deal with it. So these people would need to be explained the rules. That is, you will wear a mask. You avoid the we don't let more than 5 at a table. All these types of things. There's a level of behaviour, and of course, if you get sick, we'd expect you to come for a swab. You have to have the app on. All these types of things. There need to be a bit of training, but I think it'll be, as long as you're selecting the countries with control, and there's probably a dozen that are easy to think of there, then you could really improve the social situation for a lot of people and the economic situation for a lot of people. I must say, even if 1 or 2 people came in under these circumstances, they would probably be a dead-end case anyway. That is, if they're always wearing a mask and not mixing in large groups, that even if they were positive, they may not even spread disease. So this is the strength of Singapore's response at the moment. Of course, if we opened the gate for thousands of Europeans, then yes, we could get overwhelmed because of the situation at the other end. So again, you've got to tune this to the country that you're talking about.
Right, great points there, Prof. Fisher. Now, just to round up our discussion for today, let's focus on testing strategies. In what ways can our testing strategies be more robust when it comes to balancing safety but not hindering travellers from visiting Singapore? Prof. Teo, why don't we start with you first?
Thanks. And actually, I'll just follow on from what Dale has mentioned, because I don't think it's just about testing strategies, but more about the overall consideration that we place with respect to grouping countries in different tiers of or different levels of risk. And for countries that are in the low risk groups, we may not need to be creative with testing strategies, because generally, as what Dale has mentioned, the risk of someone coming in with an infection could be exactly the same as the risk of us meeting an infected person in Singapore when you walk along the street, which is a very low risk presently. And there's often that perception that if we now move towards a process of testing everyone that is coming in, and maybe even test them repeatedly, we can hopefully shorten the length of quarantine. It's not that, because it all comes back to the risk assessment that we perform, that we classify countries on the risk of importations and to consider the overall body of public health measures around prevention and risk management, whether it is quarantine, whether it is deciding, is it 14 days quarantine, 7 days quarantine, whether you stay at home during that quarantine process, or whether it's a dedicated facility. So it is not just about being creative or robust with your testing strategy. I like to think that it comes back to the way that we perform our risk assessment to group countries in their different levels of risk. And then we start to put in place the strategies, whether it is quarantine, whether it is an observation, whether it is testing, based on that risk assessment.
Prof. Fisher, your thoughts on this?
Yeah, I thought for sure YY, as Dean of the School of Public Health, would have started talking sensitivity and predictive values. When you're testing a low-risk population, then there's a very good chance that even if you find a positive, it's going to be a false positive. So I would actually stand up and say that these very low-risk countries, I wouldn't even test them. The chances are minute, because they have hardly any cases in their own country, and if they come, it'll be a false positive. And the effort, the logistic exercise, the cost, the diversion from other activities in doing thousands of tests in extremely low risk people, I wouldn't support. Obviously, testing in, if you like, the orange and the red lanes, then obviously, but that'd still be linked to whatever period of quarantine you wanted. So again, just like who can come in and the length of the quarantine, I think that package needs to be linked to who needs a test.
Right. Prof. Teo, do you have anything that you might want to add?
Any final word?
Yeah.
Right of reply.
Well, actually, Dale, you're exactly right, because I just worked with our colleagues at the Straits Times to share a commentary article around sensitivity and predictive values, and I believe it should be coming out soon. So read your Straits Times and you would see what we have to say around that.
Well, thank you so much, Professor Fisher, as well as Professor Teo. And like what Professor Teo mentioned, the commentary by Prof. Teo is going to be coming out, so watch out for that as well. Now, great insights from the both of you, and a pleasure to speak with the both of you, of course. We were joined by Professor Teo Yik Ying, Dean of the Saw Swee Hock School of Public Health at NUS, and Professor Dale Fisher, Senior Infectious Diseases Expert at NUH.